Thank you all. Thank you all for being here. Today we're going to talk about ambiguous loss. And this is, I know, something that as we get into it, will resonate with everyone. So I just want to kind of level set from the beginning and let you all know this is a safe place. We're going to kind of feel the feels a little bit and identify some things, but also talk through like, what do we do? Like, not just acknowledge that, there's so much loss happening in everyone's life, whether you are the person with VCP disease or whether you are a loved one or support person or neighbor, whatever it is, we're seeing all the losses. So today we're going to kind of talk about that. And I know it will be heavy at times, but hopefully we can kind of, share that together and then figure out where we go from here. Um, this is a picture of my family. And so getting into it, a couple of disclaimers. So I have a dual role here at Cure VCP because my brother is Tom. Many of you may know him. You'll also see my nephew Charlie over there to the right. But so obviously this is very near and dear to my heart because our family is hoping for a cure right along everybody else. So in addition to that, by background, I am a licensed clinical social worker, have been so for 20 some odd years, and have a long history of working with caregivers in support network, medical, social work, so all kinds of things like that. So my professional background kind of leads itself to this, but also, personally, very invested in this organization and finding a cure. Again, some of the topics that we're going to discuss today are really difficult. And so I do want to recognize that. Hopefully we'll talk through some resources, normalizing things and really kind of level setting. But if any of this is too hard, or at any point during this process for yourself, if you need to, please seek professional support for yourself to help you through this from a licensed therapist or counselor. So, this will be recorded. So if as we go through this is too hard and you need to step away, you can always come back to it. So, okay, with that, we're going to kind of jump in. So high level, a couple of objectives. We're just going to define ambiguous loss. We're going to do lots of definitions, kind of general, over high level of what we're going to do is define things. We're going to level set our understanding of, definitions, emotions. We'll look at all of this throughout the entire presentation from the perspective of, patient, care partner, support system. So no matter what your role is with all of this, hopefully you'll be able to take away some information, give you a little bit of insight, but also take away with you some actionable items that you can use in the future. It's very important that we're going to talk about the healthy emotional responses to loss, specifically ambiguous loss. And then again, identify strategies to acknowledge and live with this grief from all of this ambiguous loss that we're going to talk about. So again, starting with some definitions, this is the definition of ambiguous. And the ones that stand out that really apply to what we'll be talking about today is doubtful, uncertain nature, difficulty to comprehend, distinguish, or classify. It's just all out there. It's very vague. We can't, there's no clarity to it a lot of the time. So again, and then the next one is lacking clearness or definitiveness. So it's indistinct. So when we're talking about ambiguous loss, it's all of these very, unclear losses that you're watching, that you're experiencing, that you are seeing happen right in front of you related to this disease process. So ambiguous loss is a very specific term that was coined by psychologist Pauline Boss. And so she's kind of the pioneer in this theory. And all the research that I've done and all of my experience with this, what I found that I was doing, early on, even a few years ago, because we did a webinar and talked about ambiguous grief, or anticipatory grief. And I want to be just very clear that ambiguous loss is a very specific term. And the more I got into it, the more it makes sense, specifically for what we're talking about today. It refers to the lack of resolution and a unique kind of grief that's confusing and complex. So it's very different than a death. And that's like lots of times when we're talking about loss, we think about death. And this is very different because we're not dealing with death right now. This is all of those other losses where there is no death. There's lack of certainty about what the future holds, about what even this loss is, and whether it even qualifies as a loss. Because if you're dealing with death, as society, we really know how to handle that. Like, if somebody passes away, it's devastating, it's horrible, it's really hard. But as a culture, we know what to do. We send flowers, we send a card, we go to the visitation, we go to the funeral, we might drop off some food, and we check in on them for a little bit. So there's like a cultural ritual surrounding death as the loss. It's the difference here of what we're experiencing is there's no death, and this loss happens yesterday, it happens today, it happens tomorrow. So unlike where you're checking in on somebody who, experienced a death and we're talking a couple of weeks, if I come back and check on all of us in a month, 2 months, years, we're dealing with the same sorts of things. So there's not a finite end to this. And that's the very crux to the difference between loss and ambiguous loss. It complicates things even further because we're not experiencing death. It throws like the normal routine or order of things off. So when we think about like our family, if this is our parent that is experiencing this, sometimes our roles get shifted because our parent, for one reason or another, whether they're experiencing physical symptoms or cognitive symptoms, they may not be able to fulfill that role. And so now, like, how do you handle it if you would used to go to your parent and ask permission to things, and now you can't go to them anymore? So it's kind of it's putting the natural order of things out of balance. And so there is no resolution because it keeps going on and on. And because it's going on and on, you're stuck. They call it, you've got a frozen grief process. You're not making it through the grieving process because it's still there. You can't get to the other side because you're dealing with it every single day. And because it's prolonged, because it's chronic, all of these losses keep building up. I've talked with my brother, I've talked with other patients about this, and it's really hard because you keep experiencing them. Sometimes it's the same loss and sometimes it's a different one. You know, at first it was, lost leg strength, okay, but was still able to, move arms and, brush my hair and shave and do all of those things. But then you start losing arm strength. So all of those losses keep building up. And again, they're not losses related to death. It's loss related to your strength. It's loss related to your memory. And for all of those that are sitting here watching somebody else and living through this with them, you know, we're experiencing loss too, because the person that we once knew, our parent, our aunt, our uncle, our sibling, our kids, that person that you once knew is fading away into something different. So that's another example of ambiguous loss. So just having that change. So again, this ambiguous loss, this concept, everyone is experiencing this. All right. So again, and kind of just a level set, ambiguous loss is not related to death. This type of loss is kind of everything except death. And I do want to call out that when we're talking about, seeking professional help, or sometimes people are trying to be helpful and they want to encourage you to get help from somebody, or they're expressing concern, sometimes you might hear a term called prolonged grief disorder, and that is a actual diagnosable disorder. But I want to be clear. Prolonged grief disorder is a clinical diagnosis that has to do with the experience of grief that is at least 12 months after the death, where there has been no change in kind of resolving that death. Like they are in the throes of grief at month 12, just like they were the day after the death. Okay. In our circumstances, as we are talking about VCP disease or other related diseases, prolonged grief disorder as a mental health diagnosis does not apply because there is no death. Sometimes you might hear the term complicated grief disorder. And again, that's another mental health diagnosis. But again, by nature, it's related to death. And so what we're experiencing related to ambiguous loss does not fall under the definition of complicated grief disorder. It's also not the same as post-traumatic stress disorder, though there is trauma and there is stress. There is no post about what is being experienced through ambiguous loss. Haven't moved past any, event. There is no death to move past. So these things, I just want to call out these terms and these diagnoses because sometimes people are trying to be helpful and they say you just need to get over it. You need to move past your grief. For all the reasons that have been identified so far, it's not necessarily realistic to not be grieving because the losses are still there. There's new ones, there's old ones, there's the same ones. So I just want to call those terms out, just kind of for definition purposes and what applies here and what doesn't. So I mentioned anticipatory grief earlier, and very similar. So you'll see throughout this entire presentation, there's a lot of themes that are going to come up. So anticipatory grief is the grieving specifically around knowing that death is coming. Okay. So some of you on this call, the idea of would you want to know if you're going to die? Would you not want to know if you're going to die? There's pros, cons. I'm sure if we had a discussion on this, some people are glad that they have the time to know what's coming, and some people would rather not. Either way, with this disease, there's been recent losses and ongoing losses in the VCP community. So we are experiencing death. Okay, so we know that death is part of this. Anticipatory grief is specifically that grief that we're looking at related to knowing that death is coming. Okay, and so again, and all of us are probably at various times experiencing anticipatory grief. Whether I'm sitting here watching others decline, whether you are the one that is experiencing the decline, the fact that we know that death is coming and that is the final loss, that's what anticipatory grief is about. Grief is the emotional reaction to this loss. And I just want to call out a lot of the things that we're going to talk about, over the next, 30 minutes or so are really about making that connection of understanding what loss it is that we are grieving and how we are grieving it and what we can do about it. So that anticipatory grief is very real. Okay. And I'd like you to just know that the grief can feel the same. And sometimes, we're going to talk a little bit about control. Sometimes it gives more control knowing where that grief is coming from. Am I currently very sad knowing that, they're going to die and that's specifically what's causing it? Or am I experiencing sadness or grief right now because I see, that they're not walking as well as they once were? So all of those can give you the same feelings, but some of what we'll talk through is slowing down to know what is causing that feeling. What loss is it that we're specifically linking that feeling to? So I've mentioned quite a few of them, but some more examples of ambiguous loss, and some are specific to disease process, and some are just normal, regular, everyday life. Disease process, ambiguous loss includes the loss of a body part or body function, or, what your body can do, specific limbs, or what your mind can do. Losing cognition, losing memory, losing the executive functioning to make higher level decisions about your life. That's an ambiguous loss. In everyday life, if you have a relationship breakup, if you have divorce, especially if you have divorce with kids, that's even more confusing because even though your marriage may be over, you're still tied to that person. You're still co-parenting. You still have a relationship with them. But what you thought that relationship was going to look like is very different. And so there's loss in there. So relationships where someone's emotionally checked out, that's an ambiguous loss. Even if they're there, but they just work too much, you're still experiencing the loss of what you thought that relationship was going to be like. And in our society right now, one of the things that comes up a lot is people who are on their phones or engaged in technology and not talking to the people that you're sitting in the room with. That's an ambiguous loss. Our relationships have changed so much with technology. Being an empty nester, a lot of people look forward to that, and that, can be a rite of passage, but it's also a loss. And one of the things that we'll talk through coming up is how you prepare for these things. Because one example would be if you are one of those, and we've all seen them, parents who are 110% into their kids, and that's all they do, and whether it's their kids' activities or sports or whatever it is. And then when their kids go away to college or move out, they're devastated and they don't know what to do. And they don't know how to react. They don't know who they are anymore. So a lot of this, we're going to talk about how you prepare for these things, how you prepare for this loss, and how you kind of build yourself up for resiliency and strength now and in the future. A lot of this material comes directly from Pauline Boss. She has a training certification specifically in ambiguous loss. So a lot of this is coming. So you'll see a lot of these slides where I'm going to reference specifically her. But one of the things that she says that really resonates as we're looking at these examples of ambiguous loss is sometimes it's leaving without goodbye. So I'm sitting at a table with somebody and we're sitting here together, but they're not engaged with me. They're on their phone. We're not talking. We're distant. So there is no goodbye. They're sitting right here. Or there's goodbye without leaving. So there's two different concepts, but both of them experience a loss there. So feelings resulting from ambiguous loss. If you all wouldn't mind, if you want to put in chat, now that we've kind of defined what ambiguous loss is, can you identify any feelings that you've experienced or that you would expect to experience related to these ambiguous losses? And I'll just give you a minute to kind of think through that, maybe put some in there. Frustration, anger, absolutely. Emptiness, that's a good one. Sorrow, sadness, absolutely. Fear, range, absolutely. Those are all good ones. And you've hit on quite a lot of these. Mixed emotions. That's very, very true, Cece. Good. So yeah, there's a lot of emotions. Hmm. Determination, that's a good one, Stacy. A lot. So ambiguous loss, the, I think you'll all see as you're reading through these emotions, these feelings, that you can relate to all of them and at various times. Sometimes you're hopeless. Sometimes you're angry and you're filled with rage. Sometimes you're sad. Corey put inadequacy. Yeah, not good enough. Insecurity, fear. Absolutely, Jan. Yeah. There is no textbook on how to deal with loss, how to deal with these feelings, what to do. And so all of those things, all of these feelings that you're feeling are absolutely 100% valid. And you're not alone in that. And so I just want to call that out that, as these are coming up, see heads shaking and people can absolutely, relate to what you're saying and what you've experienced. So here's a couple of definitions of what those actually mean. And the bottom line of why I want to do this is to let you all know these emotions are normal. These are healthy. If you were not experiencing grief, going through this hellacious thing that you're going through, that would be problematic. If you were not angry, if you were not fearful, if you were not anxious, that would be a problem. But this is a horrible situation that everybody's dealing with. So our bodies, our brains are hardwired to give us emotions and thought processes that help us express ourselves and what we're going through. So grief is a natural emotional response. It, mimics sadness, couples with anger, guilt, despair. And the treatment for grief is to be around others. It's to do exactly what you're doing right now. Connect with other people. Find peers that you can share with, that they can share with you, that you can connect with, that you can all say, yep, I am really pissed off about what's happening right now. I'm also scared. And they will know exactly where you're coming from. Find support people. Engage in activities where you're not alone. Grief therapy has a place, but for grief specifically, connecting with other people is found to be more beneficial. Sadness is a symptom of depression, but in and of itself is not problematic. It's grieving, it's being unhappy. When you're sad, though, you still function. You still get up, you still go to work, you still take a shower, you still take care of others, you still do all of these things even though you're sad. Okay. Again, connect with peers, support groups, be engaged in activity. Those will lift your mood. They will help you connect your sadness with other people and validate what you're going through. Anxiety is actually a protective mechanism that whenever we're in a really uncomfortable situation, whenever we're scared, our bodies are designed to help us feel anxious so that we can ramp up those emotions and we can be strong and deal with whatever it is that we're going through. We can take on any potential threat and we can overcome it. Okay? It's intended to be a temporary, manageable state. You do not want to be anxious all the time. But the fact that you're anxious at times is a healthy reaction from your body. If it becomes excessive, persistent, if it interferes with your daily life, any of these emotions that we're talking about If they interfere with your daily life, then that's when it becomes problematic. Okay. The fact that you're experiencing it is not problematic. And I want to call that out again, just because sometimes as a society, we think that if we're dealing with these things, we shouldn't be. And so we have medications for all sorts of things. And medications, there's absolutely a place for it. It can help us take the edge off. They can do all sorts of things. But I want everybody to understand these are normal emotional reactions that we are supposed to experience. Okay? Depression, specifically major depressive disorder, that's when it becomes problematic. Okay. If it's going on for so long and to such a degree that you are not able to function, you're not getting out of bed, you're not showering, you're not eating, you're not sleeping, or you're sleeping too much, that's problematic. Okay. And then we'd want you to seek help and get some help for that level of depression. Okay. So, as we talked about before, ambiguous loss, your grief is frozen. We expect it to be here because you're dealing with this day in, day out. This diagnosis, these symptoms that you're dealing with are years. These are years long. So, we expect this grief to be happening to you ongoing. Okay. I mentioned society and our thoughts on experiencing these emotions. So, as society at large, has that expectation. Sometimes our support system has that expectation as well. Or they want you to not be sad, or they want you to get over it, or they want you to deal with it, or they want you to find closure to it. Okay. I want to stress to you all that what you're currently dealing with, there is no getting over it. Okay. That's not advice that you can take and do something with. You're having healthy emotional responses to a really horrible situation. Okay. So let the body do what the body is supposed to do. Know why your body's feeling the way it is, why your heart feels the way it does. What is the loss that you're currently, experiencing that sadness from, and recognize it. Yeah, I'm really sad, you know, that we have to plan dinners around what restaurants can accommodate a wheelchair and who's not going to be too busy and what bathrooms are available. That's what's causing my current sadness. But that's going to be ongoing. Okay. So these are not mental health crises. These are going to be going on. Do not feel like there is something wrong with you because you're experiencing these emotions. There are hard sciences and there's social sciences. Your feelings and your thought processes and all of this, those are social sciences. Okay. People who are very concrete thinkers, scientists, mathematicians, engineers, there is a problem. 2 plus 2 equals 4. There's always a linear solution. This disease process is not linear and there is no single solution to it. So just a story about, concrete thinkers to help decide if you are a concrete thinker and how hard this is going to be for you. So our dad was math guy, computer science. He was one of the first computer scientists back in the early 70s, like when they were first creating computers. When I was in college, this is the kind of stuff my dad did. When I was in college, he went back and started taking more college courses so that we could get more, grant money because there were more people in college. So he's went back to college and he's taken a sociology class of all the things for his science brain. And sociology was my undergrad degree. So he's calling me because he has to write an essay on like this abstract idea. And he does not have any idea what to write. So he's like, well, what's the answer? And I was like, there is no answer. I was like, the essay is really an exercise in what you think the answer is, because there's not one answer. He's like, well, there's got to be one answer. There's got to be a solution to this. There's got to, if you're angry, there has to be a solution. How do you become unangry? There's not. There's no one solution. There's no concrete prescription for how you deal with these things. This is not a hard science. We can't give you answers. So, however you're dealing with it, whatever you're experiencing, that is the right way for you. Okay. So, want to shift into what you do about all of these things. All of this fear, all of this anger, all of this guilt, all of these feeling that you're inadequate or, even being a burden, all of these things. Okay, how do we recognize that, acknowledge that, but move forward? So there is this concept called both and thinking. It's the idea of holding two very different concepts within the same idea. Somebody with dementia is here, yet they're gone. Two polar opposite ideas. They are both absolutely true. But if you take them away, neither one in and of itself, in its singularity, is true. So there are so many possibilities under this disease and what you're experiencing and the reality of your day to day, where there's these conflicting ideas that that are happening all the time. So it's not binary, it's not science. It's not one or the other. So people can be absent and present at the same time. So she is both gone, yet still here. Both of those are true. I must find a way to both let go and hold on. That's absolutely true. And whether that is, you know, holding on to, a hope of independence or, holding on to our relationships, whatever it is, both of those things are true. I'm sad about my lost hopes and dreams and what I thought my life was going to look like, but I'm happy about some new things that I'm seeing come out of this. So both of those things can be true. And by beginning to shift our mindset, some of these areas that become very frustrating because we're looking at one or the other, we can begin to see possibilities in the middle. So, accepting a range of emotions with this thought process, you can be both sad and experience gratitude. Okay. It's normal to feel deep sadness and grief and anger, but also you can experience gratitude for love and support and the people that check in on you in this VCP community and the moments that you're sharing and people that have reached out and told you how much they love you and all those things that come with all of this. Both of those things are true. And you can't have one without the other. We'd like to focus on just that happy gratitude piece of it, but it's still true and absolutely necessary and part of our reality to recognize that sad piece. I'm fear and hopeful. I'm fearful and hopeful. This pain, this unknown, but also the idea of comfort and peace and quality time and expressing and showing love whenever you're going through something so horrific together. Denial and acceptance, grief and relief. Yeah. So all of those are examples of the range of emotions that are both true at the exact same time, and that we have to recognize and accept that both are happening at the same time, because in their isolation, that's not accurate. That's not true. That's not our reality. When we're looking at it from a practical standpoint, so there's a lot of people out there that are doers. It's really hard to sit still because we need to do things. Sometimes it feels contradictory to plan for the future because you think you need to live in the present. You really need to do both. You need to plan for the future. We know a future is coming. Taking care of practical matters and having discussions about, um, you know, how end of life looks like. You know, trust, end of life wishes, all of those things are very true. So we need to recognize that those things. But again, I want you to begin to see possibilities of both and thinking. In applying this to problem solving, a lot of this when we talked about earlier, somebody put, things are out of your control. When we're thinking about problems and problem solving, how we define that problem opens up to what our solutions are going to be. So that both and thinking even helps us identify what our problem is. And when we shift that, we can start looking for other solutions of how to deal with this. Again, either or leaves out a whole spectrum of solutions. So think of when you're feeling like you have a problem that you can't solve, redefine that problem. Let's figure out what's different. Okay. And I'm going to kind of skip through this slide so that I can move forward to the other pillars of actual skills. But, as this is recorded, and if you want to come back, and these will be posted, but this is just an example of how to change the focus of your problem into something that you can control. Okay, so we have 6 pillars, 6 guidelines of how to live with ambiguous loss and its related grief. Okay, so whether we identify it, whether we talk about it, like all of those feelings that we've done, all of these losses that we've talked about up to this point, those are reality. Okay, what I want to introduce is an idea about being intentional about how you live with this. Okay, because if you're not intentional, sometimes life can get away from you and you just get into habits and we're doing the same things. So let's be intentional about what you can do for yourself, for your loved one, for your future generations, really, of how you live with this and how you are an example of how to live with it. So here's the 6 pillars: finding meaning, adjust mastery, reconstruct identity, normalize ambivalence, revise attachment, and discover new hope. And I want to just, put a disclaimer and a caution out here. Some of these things that I'm going to introduce are hard. They are emotionally hard, they're psychologically hard, they feel wrong. And I'm going to try to choose words that are appropriate and all of that, but we're going to feel feels in all of this. Okay. So the first one is finding meaning. You know, I cannot on the surface think of a good reason why we have VCP disease. But the fact that there is your brain with any trauma, with any experience, your brain is hardwired to try to figure out why it's happening. What making sense of something. Okay. Your brain wants to make sense of this loss and this understanding and its significance to you. This is where those contradictions are coming into play because there is no reasonable meaning as to why anybody is experiencing this disease. But there is still meaning in that, and that some things are out of our control. We can't control everything. And even when we do things the right way, life still happens. Okay. So, one way to live with ambiguous loss is to fill your life with meaning and purposeful activities. And that's not just related to your loss. That's not just related to VCP disease or whatever other illness you're dealing with, or any other ambiguous loss, whether it's a divorce or empty nesting or whatever it is. But find meaning in your life. And maybe it's related to, encouraging to find a cure. But it could be, expressing yourself through art, through poetry, finding meaning for yourself and something that fills you up and gives your life purpose. And all of these guidelines are for all of us. The person with VCP disease, their care partner, support people, loved ones. All of it. We all need meaning and purpose in our lives. What is important to you? So adjust mastery. This is really coming down to control. What do you have control over? Okay. I could sit here and spend 24/7 saying, you know, I think everybody with VCP disease just needs to get up and walk. And I can will it and I can pray for it and I can do all of these things. Okay. I don't have control over other people. I don't have control over this disease. That is out of my control. So adjusting mastery is finding the things that are under your control. Shift your focus. Okay. Make a choice about what you can control. And this is where that defining your problems comes into play. If your problem is something that is out of your control, you can't find a solution to it. There is no solution if it's outside of your control. So shift your focus to your internal mastery, mindfulness, exercise, meditation. Journaling is huge and awesome because if you journal for yourself right now, it's making the mind and heart connection, recognizing what you're thinking and what you're feeling. And then in a month, in 2 months, 6 months, you can come back and read that again. Am I in the exact same place? Do I have a different perspective? And it will help you grow and see where you're at and see where things are not the same. But that's what mastery means. It's what do you have control over? It's accepting your current reality and being intentional about how you want to live your life. Reconstructing identity. Okay, this is going to be a hard one for some folks. All right. This is about adapting your sense of self and redefining your roles within your family, within your community, with this new reality. Okay. Sometimes it could be as easy as I was always the one that paid the bills. I can no longer pay the bills. I need to give it off to somebody else. So I've lost being the bill payer, but I could be the bill payer mentor. I could be something else. So begin to incorporate new identities. And if we think about, that example from the beginning of the parents who are all invested in their kids and then they become empty nesters and they don't know what to do, this is where we begin to transition our life for the present and for the future. We don't want to wait until we're empty nesters with nothing to do to figure out who we are and how to define ourselves. We need to do it now. What do we have control over? What gives our life meaning and purpose? And how do we want to live that? And I'm going to talk specifically to our care partners for a hot minute. Okay. Care partners die at a rate 60% more than cohorts of the same age. So that factor in and of itself means that caregiving is a danger to your health. And if you don't care for yourself the right way, that's a problem for you and your loved ones in the future, and even your role as a care partner. Okay. So paradoxically, thinking about taking time off can be really hard because you think, I'm all in being a care partner, and that's who I am 100% of the time. But it's dangerous to your health. It's dangerous to the person that you're caring for because you can't be 100% all the time. And if you take care of yourself, you will be happier and you'll provide better care. So think about it from this standpoint. Okay, this is a hard concept. Okay. For a care partner, who do you want to be now and who do you want to be in the future? When somebody looks at you, when your loved one passes away and you think about what you want them to say about how you're living your life, what do you want them to say? What are you going to intentionally do to create that life, to provide purpose and meaning, and give yourself self care? When you are an example for your children, on how to live with this kind of a loss. What kind of example do you want to be for those that are looking at you in this role about who you are and how you're going to deal with this? For patients, for our folks who have VCP disease, your life looks very different and you did not get a choice in this and this was not something within your control and it looks very different. Who do you want to be? Who can you be now? Where do you want to focus your energy? And how will you carry yourself and be an example for those around you? How do you want to face your challenges? When folks look back on this, what kind of example do you want to be? You know, when we're thinking about our partners within this community, you know, who do we look up to of how they are handling themselves? What is their identity and what is their role? And so I say that the hard part being we want to be all in 100% for each other. But by very nature, we can't do that. So I need to start incorporating things in our lives now that I can do right now. I can go to dinner with friends, I can go play golf, that I can start doing now, that I will carry on into the future because I'm creating a healthy lifestyle for myself so that when my loved one passes away, I've created a life that they will be proud of me for. So normalizing ambivalence, this is, when we talked about feelings before, you all hit the nail on the head. Uncertainty, all of these things. And this group, you know, is a safe place to know that there is not one right answer. You can feel guilty, but you can feel proud at the same time. You're going to have these conflicting emotions, and it's completely okay. And people understand that. There will be times of anger, there will be times of joy. There will be times where you wish that your loved one was no longer in pain, but you feel guilty because that might come off as being, does that mean that I don't want them here anymore? That's conflictual, but that's normal. And I want them here. I don't want to see them in pain. So going on, hand in hand with our attachment or with our identity is our attachment. If our identity is 100%, I am all in as a parent and I'm doing nothing else, and I'm, my child's shadow, that's not a healthy attachment. I need to have something else in there. So we need to shift our relationships to allow for our current reality. And we can't stay attached to all of the things the exact same way as they always were. What worked once will not always work in the future. So you still want to love and honor them and find joy in all these other areas of life. But just because we're shifting attachments, and whether it's to our loved one or something else, we might need to be giving up something that, doesn't bring us joy anymore. And so that's the attachment that we're, modifying. But we need to look for ourselves of what things we need to hold on to and what we need to get rid of. And the final one is discover new hope. This is really where that, both and thinking comes in, you know, new hope. And sometimes we feel hopeless. And this is a horrible situation. And it feels bad to have hope about something that might be in the future. But we need hope in our lives and we want to create it. And so we can hope for a cure and we can support that. And that can be part of our meaning and our purpose and all of those things. But actively seek out new dreams. Maybe you're finding meaning and purpose in, I've been putting off going back to college. Maybe I want to do that. And so that new hope, you know, that's giving me hope of I'm going to get a degree, something like that. But it's an honor and it's a privilege and it's a sign of respect and love to all of our whole community here by finding things that we can be hopeful about. So actively seek out things and actively seek out goals and find a reason to carry on and help others as you're dealing with this ambiguous loss. So those are our 6 pillars. And I'm going to spend 2 minutes on these last slides and slide them through because like we talked about before, and all the things that don't apply, a couple other things that are not going to apply with what we're dealing with here. We often hear about the 5 stages of grief from Elizabeth Kubler-Ross and her grief cycle. This grief cycle in its, creation is again about death and dying. So when people are saying, oh, I'm in this stage of grief or I'm in that stage of grief, again, that is a finite loss of death. Your emotions, there is no cycle. It it is always cycling. It's always going to be confusing. It's always going to be overlapping. It is not linear. And this grief cycle is specifically was created about death and dying. The other thing we hear a lot about is closure. I want closure. And if we think about our relationships, it feels wrong to think I want to close my relationship. I don't want closure with this process. I don't want closure with my loved one. I don't want a finite end to it. Our dad died 10 years ago. And while I don't feel the same level of grief, I will always feel sadness when I think about my dad passing away. We will have this grief with us forever. There will never be any closure on this grief that we experience. So again, to reject one of those, concepts of you just need to find closure, think about it in respect of your relationship. Our human relationships, we don't necessarily want closure for. We want that love. We want those memories to carry on with us. So, in summary, you all know the losses that you're seeing. You all know the losses that you're experiencing. And the fact that they're not related to death, the fact that they are building up and compounding makes ambiguous loss so hard to deal with. So this is a marathon of losses. So our grief, our sadness, our anxiety, we expect to be here because we are sad, because we see and are experiencing these losses. Okay. Because you're feeling that, it's not a mental health crisis. Don't worry about it. It's normal. Okay. If you are having difficulty functioning, if you find that you're not getting out of bed, that you're not eating, you're not sleeping, please do reach out and seek professional help. But I hope that you use a little bit of this information to maybe kind of start thinking about things a little bit differently. And then maybe, using that both and thinking, redefining the problems, and then working through those 6 guidelines of how you can build a life for yourself of things that are under your control, of how you're going to live with this ambiguous loss.